Good morning. And we're here again with Cosmetic Surgical Podcast, Ask Dr. D. And I would like to welcome.
Hi, I'm Kristen Mulder. I'm with Revance Aesthetics, and I'm so excited to be joining you today.
Super. So today we're going to discuss what is the greatest and latest innovative technology on aesthetic field on the market right now. So how can we be doing things differently, better, utilizing the newest technology with a lot of science behind it? So could you, Crystal, tell me why Revance technology is better or different from any other traditional fillers or botulinum toxin on the market?
Yeah, absolutely. So Revance Aesthetics, as you know, we've been around for about 4 years here in the US. And what really Revance wanted to do as a company in the injectable space was create and have innovative products. So something that wasn't just a Me Too product, but that had something that was different or unique. So we have our kind of two different spaces, the injectable fillers, which is the RHA collection, as you know, which stands for resilient hyaluronic acid. What makes that different than the other hyaluronic acids that are out there on the market currently or prior to RHA is that we are indicated for dynamic wrinkles and folds. So the actual product is designed to look good dynamically as you're moving and talking and laughing and living life, and not just in that static position. And then with Daxxify is our neurotoxin, and it was created, it's the first and only peptide-powered neurotoxin. So we have a peptide that is kind of our delivery system, and what that does is it allows for the product to kick in very fast. It allows for the product to last longer, and it also gives the skin a really pretty glow.
Actually, this product is totally changed my practice. First of all, to inject filler and do not see the filler. This is a big deal. Just looking so naturally and dynamically optimized, just amazing. And how easy it is to inject. Oh my God, phenomenal. I keep talking and telling my physician assistant all the time that I wish during my training career, I had this particular filler before, like 15, 20 years ago. It would make my training way easier and potentially eliminated mistakes. You know, we all make mistakes. I'm not perfect like nobody else, but it would help me to eliminate a lot of mishaps, especially in the beginning of my career. So, but Daxxify, that glow, it's nicely freezes the muscles like other botulinum toxins, but I have never seen my patient come back for follow-ups and glowing. It would be impossible to depict earlier, and now I'm enjoying every time they would come in. Oh my God. And they're just phenomenal difference in my practice.
Yeah, and we've absolutely seen that consistently in practices across the country. In fact, it was something that the glow wasn't something we necessarily started out thinking that was going to be a thing, and it was kind of a nice side effect, if you will, of the product. So, but just having the different way that it looks on the skin is a nice side effect for it, for sure.
Do you know how long did it take for a company from the idea they had to actually implement?
Yeah, so
the product?
Revance owns Daxxify. So we created the product, and the actual start of Daxxify was around 1999. Mm-hmm. And the interesting thing about it is it was actually created to be a topical treatment. And when they started with the clinical trials with that, there were people doing the trials that were like, this product actually should be injected. If you can get this down, inject it into the muscle like you do other conventional neurotoxins, it's going to be a game changer. And so they stopped the clinical trials on the topical and then moved to actually creating ones to where they were injecting it similar to the conventional toxins, and then develop that, and then you go through a dosing study to figure out what optimal dosing is for safety and efficacy, as well as then the actual clinical trial. So it's again, what are we in 2024? So it's been almost a 25-year process, and we were approved in September of 2022. So about 20 years, really,
Yeah.
which ours took a little longer because we went from the topical to the injections. And then also there was the fun COVID years too that changed how quickly things were being approved and so forth, or they were approving other things at the time, and aesthetics was put a little on the back burner.
Right. So it's also very, very unique concept. What we have utilized in our practice is topical application or injecting in micro droplets. For example, for fine wrinkles, especially fine wrinkles around the lower cheeks or neck. So we can actually address by utilizing micro droplets or using micro needling and applying topically. So we can kind of like roughen up the skin, and then it gets, and effect is again phenomenal. It just glow. It adds amazing amount of glow. Just phenomenal. I love that fact, because by the end of the day, quality of the skin is fundamentally important no matter what we do. So that's what this product does.
And I love hearing that. We obviously are on label for glabella, but getting to hear from you and different people about how they use it in different ways has been exciting as well. So we love hearing that from you and love hearing about your results.
Yes, it's just because Daxxify is peptide-powered, and peptides are the most powerful anti-aging type of treatment in every single application, and that's what actually adds the power of quality, improving significant quality of the skin. So along with everything else. So what other main components would our consumers should know about your product, why it's so different?
Yeah, so we can start, again, Revance, the company that we distribute RHA and then own Daxxify here in the United States. Again, our biggest thing was just to have innovative products, so something that was different. With RHA, when I said before, dynamic, so the way that we preserve RHA is different than the other products out there. So we use something called Preserve Network technology. It is, if you think of kind of like sous vide cooking, it's similar to something like that, where we have RHA, we put them in kind of a plastic bag and heat the temperature in water. So we're cooking that HA, but we can use a lower temperature and we'll cook it for longer. And that keeps the process a little bit more stabilized. And what that does is then preserve long HA chains. So we're about 5 times longer in our HA chains than any of the other products out there. And so it behaves in the tissue a lot more like your body's naturally. It intrinsically bonds within itself. So there can be a low amount of modification or a low amount of cross-linking so that it is the most like the body's naturally. And then also what's unique is that because it's made to be dynamic in those mobile areas of the face, you can inject it a lot more superficially. So different than some of the other products that are out there, and I'm sure that you see in your practice, you are able to use these products more superficially to give a very natural result to replace superficial fat loss in the face and give a natural contour back to the face that you maybe aren't able to do with some of the other products because they need to be buried so you don't see them. So that's kind of where RHA is different. We have 4 different products on the market, so you can kind of use them all over the dynamic areas of the face. And then we have with Daxxify, what makes it unique is, again, the peptide that we keep talking about. So we're the only peptide-driven neurotoxin that's out there, the first and only, and that peptide allows for us to eliminate any type of human or animal byproducts. So it's the first one that's made in the United States, and it was really developed to last longer. So everybody wants things to last longer whenever we're coming in and having treatments done and talking about looking good and all of that. So it was developed to last longer, but other huge benefits of Daxxify is that quick onset. Some people I mean, people can see results as quick as next day. Most will start seeing them by 2. And then again, that beautiful glow in the skin that we've talked about as well is also something that, makes Daxxify unique to any of the other products out there.
Exactly. Because it's peptide powered, even though it can last. Everything depends. Of course, this is a very tricky area. It can last 5 months, 4 months, 3 months, 6 months. Everything depends on your lifestyle. It's pretty much multifactorial. But great thing about Daxxify, and that's why I think this is the future. This is the future product. Because of peptide, skin would not go back to the baseline. It will have some improvement. Every time you use it, it doesn't matter, 3 months, every 3 months, every 4, and everybody is gonna be different, but your skin every time, and I see that, it will be improved. That's a huge benefit. So you're getting like in one shot, 2 major benefits. You're regenerating your skin and at the same time preserving your skin by controlling the dynamic movement. This is actually very, very innovative, and that's why I truly believe. I always try to bring into my practice something so futuristic in a way that I see potential and deliver the best what I could to my patients. And going back to fillers, RHA fillers, we have whole spectrum from thinnest to thickest, but also very, very difficult area to inject and achieve perfect seamless results would be under eyes. With RHA fillers, it's absolutely the easiest task for any injectors. So how you think your company how much resources it puts into training and actually educating clients or injectors, professionals?
Yeah, so the nice and unique thing about RHA is actually comes from Switzerland. And it was created by a woman who was the co-creator of Juvederm and then left that company to create Teoxane, which is the owner of the brand RHA, because she wanted something more like the body's naturally. And so Teoxane is a global brand, and we here, Revance, are the distributors of the brand in the United States. With that, we have had the amazing opportunity to get to work with some wonderful international physicians who train all over the world with these products. And so we have, all types of different resources when it comes to training, anything from, we have a ton of things, just virtual libraries. We have training that people can do where they can Zoom and have one-off conversations. We have live virtual trainings with state-of-the-art equipment where you can literally watch live virtual trainings, almost like you're sitting in the room with them. And then we have the ability to have trainers that have been trained by our staff and some of the international trainers across the country to go into offices and do one-on-one trainings. And then we lastly have our state-of-the-art facility in Nashville that we have the opportunity to sometimes bring practitioners there as well. And we just had one here in New York a few weeks ago, but starting to do kind of trainings on the road too on a bigger scale as well, kind of mimicking what we can do in Nashville on the road in different cities as well. So we try to cover all the bases on training, but training is something that is a huge priority. And again, with these products, you can use them differently. So getting training on them is always a benefit.
So have you found that it's much easier to train clients or professionals with utilizing RHA filler rather than something else?
I think that the way how you said you wish you would have had this 15, 20 years ago or whatever, especially working with the newer injectors and things like that, it's a very forgiving product. So I think that people, they love the way that it injects, they love the way that it integrates, they love all of the different processes of RHA. So I would have to say that people when they have the trainings, they really like the experience of RHA. And once a practitioner starts to utilize RHA, they realize that it's different in the way that it injects and the way that it behaves in the tissue and the results that they feel like they can get.
Exactly. It is very malleable. So you can just you inject, it's very forgiving, malleable. You can artistically actually position exactly where you want to position, how deep, how more superficial it could be. And sometimes you have to, as I said before, injecting under eyes could be very, very, very challenging. And that's where you have areas where you have to be more superficial or less. And that product can give you that variety of options right there and there. So perfect. I think that we are, as I said before, this is the future behind this kind of innovative technology. And what do you know if something is cooking or something interesting is your company will surprise us in near future?
I mean, there's always things cooking, and unfortunately, especially on the sales side of things, we don't get a lot of the information ahead of time. But I would say the things on the horizon right now are going to be more indications. We started with dynamic wrinkles and folds, and then we were able to launch Redensity, which was an amazing product a little bit after that. We got our lip indication this year. So hoping to continue different areas, maybe some of the areas that you've spoken about today that aren't necessarily on label, getting different indications and so forth. But I don't have a ton of sneak peek information that they give me. They keep it kind of hush-hush, unfortunately. Right. But with continuing to expand just the brands and the opportunities and so forth, innovation, again, is our number one thing. So wanting to stay ahead of the curve when it comes to all the things that people are out there doing and using.
I think it should be the standard of care. We need to be always ahead of the curve, because if we're not evolving, we're becoming dinosaurs.
Right.
So exactly, and world is evolving so fast.
This industry is evolving so fast.
So fast. And our clients or our customers or my patients or your patients, they deserve to have the best out of the best. Unique, innovative, and latest technology.
Yeah, I feel like that's a good thing because it's still the number one thing.
In my practice, my personal experience, utilizing your product, fillers and RHA fillers and Doxify, my patients, they do not look overfilled, they look natural. And also very important to see dynamic movement. For example, when patient, okay, let's put it this way, patient after 28 or something, or women after 28, actually men, they more or less utilize fillers or botulinum toxin. And when I see outside at the restaurant or at the store, they start smiling, right? And you can clearly depict that, she or he has filler. Why? Because when they smile, fillers, unlike RHA fillers, they do not have these dynamic properties. They stay where they injected into. That's why when patients smile, you can clearly see those apple cheeks or some sort of abrupt definition in bones. So that's why RHA is absolutely unique because of dynamic structure. So, but also, it's very difficult. No, it's not difficult. It's possible to overfill. Definitely depends how much you are going to inject. You could do it, but even though, take into consideration the fact that RHA fillers are very forgiving, probably way more difficult to overfill than otherwise.
Yeah, I mean, I think that RHA, with it having that dynamic indication, it's really developed to look natural in the face. And people, that's the number one reason people are scared of fillers, because when they're out and about, they can see it in other people. And so they think that that's the only option, is to look that overdone or the overfilled. And so having something with RHA, and then obviously a good physician injector that is able to to do it. That makes a huge difference as well. But just making sure, or you can use less product, you can use it superficially. It's made to move naturally with the face. And I don't want to say you can't do it, because you can do it with anything, but it is almost a lot harder to make somebody look unnatural and augmented with RHA.
Because of dynamic nature.
Yeah.
Because of also, it's very lumpy, clumpy, bumpy. You can easily see with other fillers on the market. I have utilized RHA for close to 2-something plus years, and I have not had this issue of creating some lumps and bumps. Why? Forgiven. It's very easy to massage and make it as smooth as possible. Again, because of this very forgiving structure and dynamic nature. So I think we're going to continue. We're sticking with RHA, and truly, if somebody is looking to have natural look and optimize skin quality, they actually should look into that and do more research. Crystal, thank you so much. I think we're just trying to educate patients.
Yeah, I love it.
Right here, we're not just advertising anything, nothing. We just pure educational component.
Yeah.
What is there? Why is there? Something they need to know.
Yeah, I love it.
And they don't know.
Yeah,
And
I feel so lucky that I got to do it.
They come in and why it's so expensive? Because, and you stand there and you try to explain to them, and still it's coming from me, now it's coming from you, then maybe it's gonna come from somebody else, and then it's gonna biased component is gonna be alleviated.
Yes.
Or lifted.
Yeah.
Right? Of course, we are biased, but maybe at some point we're gonna bring patient and they will have their personal experience, because I'm sure you worked before with other companies, right? So you work with other company, you can compare.
Yeah.
I can compare. It was like very difficult to work with Juvederm, Moviderm.
Yeah.
That's where I start.
And I think that I don't think that we the nice thing with our products is because they're unique, we don't have to talk negative about the other products, because
we don't.
It's just, ours are just different. It's preference or whatever. So I feel like we always try not to say, even though they're,
I can talk about my preferences.
Yeah.
For example, Botox, Allergan, right? Even though it was first on the market, I used once in my life. I said, I don't like it. And I was lucky that Dysport came in the picture, and I started using Dysport, and I loved Dysport. Then, yes, I tried once or twice, didn't like it at all. I didn't like it. Xeomin, oh my God, I loved how it kicks in. I'm sorry, it doesn't last like 1.5 months. I'm not going to inject myself every 2 months, but it kicks in beautifully. But longevity is not there. And then Daxxify came into picture, and since that I started using Daxxify. And SD Medical Art utilizing your product only. So for me to discard everything I used in the past and just concentrate on Revance, it was a big deal.
Yeah.
But why? Because I truly love, and I am a consumer. I put in my face, that's exactly what I put into patients, because I need to stand in front of them and with full confidence and based on my personal experience to explain to them, hey, you're gonna feel a little bit burning, you're gonna look 5 days like that, or you're gonna experience that and you're gonna love it by the end of the day.
Right.
And I don't want them to come back and tell me, Dr. Danovich, you promised that I'm gonna love it, but I experienced Y and Z and everything, just you did not explain to me. I have to be honest all the time.
Right.
And if I'm going to inject your face, I have to experience on my own.
Absolutely.
So that's pretty much my idea in everything, actually.
I'm sure everyone wants to know what you do because you look fabulous. So they're like, just replicate whatever you're doing on me.
Right. So that's what my also very big thing is: skin quality. I want skin quality. That's a key. Skin quality. So stem cells, peptides, dynamic product. That's what makes your skin looking great as well. So in one shot, 2 benefits. That's great with Doxify, for example. So that what actually sold me this peptide-powered type of deal. So
yeah, I mean, it is something that makes it so unique and different. And then peptides now, you hear it, it's in all the different skincare and makeups and, injecting it and different things like that. So like it's been an exciting.
But the biggest
time.
advantage of Doxify that we inject peptide, and peptides are very large molecules. Unfortunately, we do not have transporters to get this molecule and get through the intact epidermis and get under the skin. It's impossible. Of course, they put into skincare line, fine, but they cannot elicit any efficacy of it because peptides are very large. Now we have option to inject peptides. We have actually option to efficiently use peptides along with preserving the dynamic movements. So Doxify, as of now, this is the only way to go. Just deliver peptides along with botulinum toxin. But I inject peptides for rejuvenation purpose. I use peptides in addition to Doxify, of course. And actually, that's a great idea to rejuvenate your body from inside out. But starting with Doxify is not a bad idea. To start feeling taste for peptides.
Yeah.
But peptides are also gonna be a future down the road. I think personally that everybody would start injecting peptides. So same as right now we are more and more utilizing exosomes and stem cells and all this stuff. But again, this is also very dicey area. But still, again, those topics are for future discussions.
Yeah.
But again, we are using Doxify and we'll continue using, and very much excited for new approved applications of this amazing product.
Thank you.